You see, scapula is a triangular bone. It has got a lateral border, a medial border, a superior border, an inferior angle, an inferior angle, a medial angle, and a lateral angle. The lateral angle is like a pear. It is concave anteriorly and convex posteriorly. That is called as the glenoid, and it articulates with the head of the humerus, forming the shoulder joint. Now, besides the angles and borders, the scapula, this triangular bone, will have a posterior surface and an anterior surface. Now we are trying to see the posterior surface first. From the posterior surface, there is a shelf-like projection which is called as the spine of the scapula. And this converts the posterior surface area into a supraspinous and an infraspinous area. And this spine is projecting by a notch, which is called as the spinoglenoid notch. And anterior to the spine of scapula anterior to the spine of the scapula is a finger-shaped projection directed anteriorly and externally, which is called as the coracoid. Now this coracoid has got three muscles attached to it, which two are going towards the arm, which is the coracobrachialis, getting attached to the middle of the medial border of the shaft, and short head of biceps. Then there is this suprascapular notch, where there is a ligament, transverse scapular ligament. Below the ligament passes the nerve, the suprascapular nerve, and above it passes the suprascapular artery. Nothing is attached to the superior border, but to the medial border is attached the levator scapulae. Two things about the levator scapulae are that if it is short, it will prevent the descent of the scapula. The shoulder on the affected side will be high, and that shoulder is called as springal shoulder. And if it is bilateral, it is called as Klippel Field syndrome. And if it is ossified, it is called as omovertebral bar. So that is the levator scapulae. And then the other muscles attached to the medial side are the rhomboides minor and rhomboides major. Then from the supraspinous region is the origin of the supraspinatus, covering all this, passing under the acromion and getting attached to the greater tuberosity. The infraspinatus, from the infraspinous fossa, getting again attached to the greater tuberosity. And the teres minor arising from the upper part of the medial border getting attached to the greater tuberosity. So supraspinatus, infraspinatus, teres minor form the sit structures, SIT, on the greater tuberosity. So sit sits on the greater tuberosity, the supraspinatus, infraspinatus, teres minor. The teres major muscle, however, goes anterior to the shaft of humerus, and anterior to the shaft of the humerus is a bicipital groove. We'll make it dot dot dot. It has got a medial lip and it has got a lateral lip. So the teres major attaches to the medial lip. It attaches to the medial lip. The pectoralis major attaches to the lateral lip, and a muscle which is called as the latissimus dorsi, which winds round the lower border of the teres major, gets attached in between. The two. So there is a lady, latissimus dorsi, between two majors, pectoralis major and teres major. Then we make another structure here arising from the infraglenoid tubercle. Anterior to the teres minor is the long head of triceps, and it becomes visible here, becomes like this, and goes here and merges with, so it becomes muscular. It has become muscular here, and it merges with the lateral head arising from this part and the medial head arising from this part, and between the two heads is a groove in which lies the radial nerve, right? Radial nerve and profunda brachii artery. Now, this is the profunda brachii artery coming, and here is the radial nerve coming. So, there are actually one quadrangular space and two triangular spaces created. The quadrangular space is between the teres minor, long head of triceps, teres major, and surgical neck of humerus. And this passes the axillary nerve and the profunda posterior part of the circumflex humeral artery. The lateral triangular space, which is here, and shaft of humerus, it passes the radial nerve and the profunda brachii artery, and nothing passes through the medial triangular space bounded by teres minor, teres major, and long head of triceps. So these are the quadrangular and triangular spaces of the, and this is the latissimus dorsi. So these are the quadrangular and triangular spaces around this. Now, if on this we are able to place the triceps will arise from the posterior border of the clavicle, from the medial border of the acromion, from the superior border of the spine of scapula, around this, and from the inferior border up to the deltoid tuberosity that you see here. And this will be the trapezius muscle, winding around this like this. So if you observe this axis, this part is being pulled down by this, and this part is being pulled up by this, and therefore on this axis the scapula will be able to rotate up. The scapular rotation will occur at an axis which passes from the deltoid tuberosity to the sternoclavicular joint, because the movement is actually occurring at the sternoclavicular joint, and the clavicle is actually going up in relation to the sternum. So this is the trapezius. From the anterior border of the clavicle, from the outer border of the acromion, and from the inferior border of the spinous scapula up to the deltoid tuberosity will arise the deltoid, which will be inserted into the deltoid tuberosity, and this will cover all the structures that I have mentioned. From this side, from the spine side, coming like this, winding round the lower border of the teres major is the latissimus dorsi, and here of course you will see a part of the teres major here and teres minor like this. So you will see the medial triangular space here, you will see the teres major and minor, you will see the infraspinatus from this space like this. But this is the deltoid, this is the latissimus dorsi, and this is the trapezius. This is the trapezius. So from the trapezius and the latissimus dorsi and the medial border of the clavicle, there is a famous triangle through which you can actually auscultate the chest, and this is called as the triangle of auscultation. Now we will turn the scapula around like this, and one of the first things we will like to draw is, in this turned around scapula, is the serratus anterior muscle, which arises from the medial border like this. From the medial border it comes around and attaches to the ribs. So as it does this, it will actually pull the scapula forward, protract the scapula. This is the serratus anterior muscle, and it has its own nerve supply, the long thoracic nerve, coming from the brachial plexus. From the roots of the brachial plexus, 3, 4, 5 phrenic, 5 dorsal scapular, and 5, 6, 7 the nerve to serratus anterior. Now we'll make another muscle here, and that is, first of all we'll place the biceps, the long head of biceps coming to the bicipital groove, which lies between the lesser tuberosity and the greater tuberosity. And this biceps is covered, here will be the anatomical capsule, and this anatomical capsule will extend across the bicipital groove, covering this biceps tendon. And now this biceps is converted into a muscle. The short head of the biceps will arise from the coracoid process and will become the other head. So it's biceps, 2 heads. Then another muscle from the coracoid process will be the coracobrachialis, and the third muscle will be going to the chest wall, will be the pectoralis minor. The coracoid process itself will have a ligament coracoclavicular, coracoacromion, and coracohumeral. So three ligaments, three muscles: coracoclavicular, coracoacromion, coracohumeral ligaments, and short head of biceps, coracobrachialis, pectoralis minor. These are the attachments of the coracoid process. Underneath these, you will see. So after this, we'll switch to another view. Underneath this, you will now see the lax part of the capsule, the biceps tendon, and this capsule covering the head of the humerus. Behind it, you will see the teres minor muscle going and getting attached to this part of the humerus. From above, you will see coming from under the acromion, the supraspinatus, and between the two, the attachment of the infraspinatus. So they form the sit structures here. So this is teres minor. Then you are seeing this bicipital groove. You are seeing the biceps tendon, and you are seeing this bicipital groove. So I will attach the teres major on the medial lip of the bicipital groove. So this is the teres major. I will attach the pectoralis major on the lateral lip, and between the two I will make the latissimus dorsi wind round. Make the latissimus dorsi wind round and get attached to the base. So this is the winding round of the latissimus dorsi. Attached lady between two majors. So then I'll place finally the subscapularis muscle arising from the subscapular fossa and attached to the lesser tuberosity. So now from this side, the quadrangular space is bounded superiorly by lax part of capsule sandwiched between subscapularis and teres minor, inferiorly by teres major, laterally by surgical neck of humerus, and medially by the long head of triceps, which goes like this. The posterior cord has an upper subscapular, lower subscapular branch, branched to the latissimus dorsi, passes through the quadrangular space forming the posterior axillary nerve, supplies the teres minor and the deltoid, and a regiment batch area on the skin. So this is the axillary nerve. The posterior cord continues as the radial nerve passes through the lateral triangular space, lies in the groove on the posterior surface of the humerus, which is the radial groove, winds round the humerus, piercing the lateral intermuscular septum, and comes to lie between the brachioradialis and the brachialis muscle. So that's the course of the radial nerve. Now I'll try to stop here.